Hi, my name is Gilberto Lopez. I'm a professor here at Arizona State University's School of Transborder Studies. I'm also director of the COVID Latino Health Communication Campaign. The reason this campaign came about is in March of 2020, the World Health Organization declared COVID a global pandemic. Since then, we know that the pandemic has disproportionately affected communities of color here in the United States, with Latino having the highest rates of infection and among the highest rates of death because of COVID. A lot of this has to do with a lot of the social inequities that were existing before COVID. And one of these was the information or lack of information that was coming to the Latino community in the same rates and the same quality as it was coming down to other communities. So what we did, we collected data, we launched a series of research studies to understand beliefs, attitudes, and behaviors around COVID-19 in the Latinx communities across California and Arizona. We used that data to inform this campaign and to create culturally tailored messages that were not reaching this community. And the goal was to create messages that were easy to understand and accessible and culturally accessible to this population.
Les habla su capitán, soy la Buen Rostro. Gracias por volar con nosotros. Estaremos despegando en unos momentos.
Algunos aspectos a tener en cuenta mientras se abrochan los cinturones de seguridad. Aunque la gente ha reanudado los viajes, todavía tenemos que ser cautelosos, especialmente a nivel internacional. Sobrevolaremos países en los que las tasas de COVID todavía son altas y las tasas de vacunación siguen siendo bajas. Es importante, por amor a nuestros familiares, evitar los viajes en la medida de lo posible. Pero si tienes que hacerlo, asegúrate de vacunarte. Y recuerde que, aunque esté vacunado, puede poner en riesgo a las personas al celebrar grandes reuniones.
Así que hazlo simple, hazlo pequeño. ¿Quieres asegurarte de que todo el mundo esté allí para la próxima reunión?
My name is Megan Srinivas. I'm an infectious disease physician at the University of North Carolina, where I also do translational health policy research, looking at how we can improve systems to address health disparities. Really seeing my patients in the rural atmosphere, seeing a lot of my Spanish-speaking patients, my patients who are migrants who might not have access to the same care as everybody else in this country, made me realize that there's a huge gap there that needed to be filled. Much of the information that we were having put out about COVID-19 in the early part of the pandemic was completely in English. And it also presumed a certain level of health literacy. It wasn't accessible to many of my patients. So working with Gil and Mustafa and the entire team behind COVID Latino was really motivated by trying to fill this gap. And by being on the ground, seeing what my patients are asking me and what they don't have access to has helped to inform how we should move these videos forward, which information we should really address first, and what the biggest crises are that are keeping people from making safe decisions for themselves in this pandemic.
Hell no. I'm not getting that vaccine. You shouldn't either, Susana. You could become sterile if you take it. You will never be pregnant.
Are you done yet, Tío Rigo? There is no reason to think that COVID vaccines cause infertility in women or men. The vaccine is very safe for anyone who is pregnant or want to get pregnant one day, and for new mothers that are breastfeeding. Actually, pregnant women get sicker with COVID-19, and the virus can cause really bad outcomes in pregnancy for both the mom and the baby. I want to have kids too one day, Tío Rigo. But in the meantime, I will get the vaccine to protect the family I currently have.
The doctor is right. I too got the vaccine and can't wait to hug my little angel grandkids.
Hi, I'm Mustafa Asnan, and I'm the founder and CEO of Creative Frontiers and Frontiers Animation. Our role in this project was to take the science from the COVID Latino team and convert it into a script that incorporated humor and pathos while conveying the life-changing information essential for this project. We have a diverse and multicultural creative team that worked on creating the art and animations for this project. The most immediate challenge with the COVID Latino project was to find a visual language that was instantly recognizable and accessible while conveying the rich humor and pathos that is associated with Latin American content. We researched different styles that are popular in America as well as parts of Latin America, because we understand that the community is very diverse in America. And we wanted to ensure that we could infuse the video with popular visual styles. So we researched popular telenovelas, as well as content, animated content, and other content as well. We wanted to make sure that the content was instantly recognizable by the community, that it would immediately engage them, and they would also be able to see themselves in the video content. This was important because we wanted to engage both young people and while at the same time offering something familiar to the older generation. Animation as a medium is incredibly effective. It's very effective on social media and creates a lot of engagement. It's also a very cost-effective medium. And the best part of it is that because of a shorter production cycle, we're actually able to create content at a very, very rapid pace. This has allowed us to be adaptable and respond to the ever-changing nature of this virus.
¿Crees que Puchi pueda ponerse la vacuna? Ella es mi cochita pechocha y no quiero que se ponga enfermita.
Panchito está un poco más abajo en la lista. ¿Pero sabías que Junior puede ser vacunado? La vacuna ya ha sido aprobada para niños de 12 años en adelante. Esto sucedió después de pruebas en cientos de niños que se ofrecieron como voluntarios para recibir la vacuna y supervisándolos atentamente por meses. La vacuna protegió al 100% de los niños de enfermarse gravemente de COVID en estas pruebas. Sabemos que los niños pueden enfermarse mucho e incluso fallecer de COVID. La vacuna evita que esto suceda. Así que mientras que Panchito espera su turno, vamos a llevar a Junior al centro de vacunación lo más pronto posible.
So this work is important because if people don't have access to the right information, they can't make the right decisions. We have so much disinformation being spread through social media, through everyday conversations, people who don't know where to turn for accurate information. So if we can provide answers to those questions from a reputable source and in a language that people can understand, both because we're speaking not at a scientific level, but at an everyday conversational level, but also providing it in more languages than just English, making it something that people can relate to. Not everybody can relate to baseball. Not everybody can relate to somebody standing on a podium and talking about a history that they were never a part of. With COVID Latino, we're able to embed the fact that we have family units, that we look up to our grandmothers in our cultures, the fact that we respect our elders, have close family ties. We can look into different cultural aspects that are not taken into account in typical public health information spreading. And then we put it in digestible little chunks. So these short animations that are almost fun to watch, that have music, that are entertaining, but also give you the most important information that answer your questions. And that enables people, everyday people, to make the decisions in their lives that matter. It might convince somebody that a mask is important and that meme that they saw on Facebook isn't accurate. It might tell somebody why getting a vaccine not just protects themselves, but might protect their children, their parents, their grandparents. And that might be the difference in getting somebody vaccinated. Why should somebody just follow a rule because it was put out by the CDC? We need to explain where the science came from, where the data came from, especially when we're trying to fight the disinformation that's out there.
Raza, les van a poner un chip con la vacuna. Nos quieren rastrear. Van a monitorear todo lo que hagan. Miren, estoy tan molesto que mi temperatura subió a 102 grados.
Ay, tío Rigo, no hay ningún chip en la vacuna. Deje de andar calentando cabezas por sus redes sociales. Si nuestra comunidad no se vacuna, el virus seguirá trasladándose de cuerpo en cuerpo creando nuevas mutaciones, las cuales podrían volverse inmunes a las vacunas. Por eso todos necesitan vacunarse, porque la vacuna entrena a tu cuerpo a combatir el virus desde adentro. La vacuna contiene algo que se parece a una parte del virus, pero no es el virus en sí. Esto reprograma a nuestros cuerpos para que reconozcan el virus verdadero a través de la creación de anticuerpos. Los anticuerpos son defensas que pueden atacar y eliminar al virus antes de que comience a propagarse. Así que asegúrese de ir y ser vacunado.
Rigo, la doctora tiene razón. Basta de locuras. Nadie quiere monitorear lo que haces. Y si quisieran, ya pones todo en internet. Guarda esa cosa y ven a comer unos frijolitos con nopales.
So we decided that we needed to do these animations in other languages besides English and Spanish, mainly because here in the US, we have a growing number, and it's already a large number, and a growing number of indigenous immigrants from Latin America whose primary language is not Spanish or English, or who are bilingual, bicultural in Spanish, indigenous languages, or English and indigenous languages. And we feel it's important because these communities within Latin America and the immigrant communities in the US are among the most marginalized in the immigrant communities from Latin America in general. So it's important that we have this information in the languages that they speak. So what we did, we connected with a group from Los Angeles, a Zapoteco family who is helping us with translation into Zapoteco. And so we designed a series of Zapoteco language animations, and we are hoping to expand this to include other Mayan languages, as well as Mixteco, which is two languages from southern Mexico and the Caribbean in Mexico. So we hope to expand this, and we would also be looking into including other languages from other linguistic minorities in the United States and across the world.
San, ishwelesh la nani.
Ma chapaksare vitoso gishiche coronavirus. Shikilina Johnny Leka. Vanexido Kanyali. Vitovi confianza podena.
Nibade. Ma, vitovi cuidado kan jaksache jokatan zojo yeshana. La cuerpchun stila lena de malka. Convençua cuerpchun nakan kat bena stila len bena yola. Patson len provnit stila lena de malka. Yeshana jishko en cuerpchun pargejelen de mala. Palla benaka jisalana gakena. Ajisalano hichake atsu edela. Haga yogo en sakcheka. Bena sang bitok sakshene. Bena sinka babosa sede. Nabasre nezene bitobish le jono. Langsa jakshendo lata. Kishena jaklena cuerpchun parjotan de mala.
Shushkreno sang. Naba nezana de kichiyala swa yeshana. Jonan bien so jono.
She question bin lo bashli dale.
Nakan toshwa de chipla.
For this project, we collaborated with various organizations and institutions. Primarily, this project is out of Arizona State University in collaboration with the University of California, Merced. And we also have collaboration with community organizations like Cultiva la Salud out of Merced, California. And we have the Arizona Community Health Workers Organization here out of Arizona. And in addition, we have some collaboration with University of North Carolina, Chapel Hill, Harvard University, and UC San Francisco, where we have researchers, community organizers, community leaders, and other academics who are part of this project.
Hola, I'm Norma Marti in North Carolina. I'm part of North Carolina SEAL, which is a response for COVID engagement of historically marginalized populations for the Latino, Latinx, Hispanic community response team. It's a group of about 13 of us in collaboration with our African American and our American Indian CRTs to work at reaching out to our Latino communities and again, historically marginalized populations. We came together, knew what the issues were. We know what the problems and the challenges and the hesitancies and the barriers, and wanted to do something that would reach out to our community in Espanol, that reflected who we are as a people. We could see ourselves in the characters, and the animations that Dr. Gilberto Lopez had begun creating out in the Arizona State and with his partners on the West Coast were just perfect. We loved them. We agreed to help support them financially. We've been part of the advisory team and just absolutely love the fact that our Vacúnate Latino NC Facebook page features every one of them, and we've gotten hundreds and thousands of hits on them. They look like us. I am Mama Lucha. Thank you so much for this opportunity. So very proud to be a part of this team.
My name is Irene Yen. I'm professor of public health at the University of California, Merced. I feel that using the cartoon video format is really important as another way to provide information for the Spanish language community. I am really happy to provide ideas and insights and suggestions for the storylines that we're using, the characters that we're developing, and the topics that we're featuring on the videos. I think it's really important to get information out in different ways and in different languages.
My name is Nancy Burke. I'm a professor of public health and anthropology at the University of California, Merced. I'm collaborating on this project because I'm a community-based researcher concerned about the low vaccination rates in our region. And this innovative and exciting approach to communication is incredibly useful for addressing some of the misinformation and lack of communication that we're seeing in our region.
Me tengo que ir. Hoy tengo mi cita para la segunda dosis.
¿De nuevo, Susana? ¿No acabas de vacunarte el mes pasado? ¿De qué vale de todas formas? Ya te vacunaste. Si fuese yo no lidiaría con más inyecciones. ¿No es así, Cochita? Claro que sí. Oh, claro que sí.
Así no es como funciona, Zoila. A excepción de la vacuna de Johnson & Johnson, todas las otras vacunas disponibles en los Estados Unidos requieren una dosis de refuerzo. Con una dosis solo estás parcialmente protegido. Pero con ambas dosis obtienes una protección completa e incluso dura más. Necesitas de ambas dosis para conseguir resultados completos. Así que, Panchito, dile a Zoila, ponte las 2 dosis. De esta forma, todos podremos estar a salvo.
We have a group of students who have been essential to this project. We have students here at Arizona State University School of Transborder Studies, and then we have students at UC Merced who are also part of this project. Their work has been essential, fundamental for this project. They help us run the websites. They helped us upload and maintain the social media content that we're putting out there. They created a lot of the content that we posted on social media, and we couldn't have done this without the students.
Hi everybody, my name is Bertha. I am part of the COVID Latino project because I feel it is very important to reach the communities that are in need and that are being less misled by the media. And I think what better way to do it than making animations and videos that they are actually able to understand, that it's in their language, and they feel that they are able to relate to. Powerful.
I am part of the project because I want to be part of the solution. I want to help educate the Hispanic community and bring awareness. I want to help my community feel safe about obtaining the COVID vaccine and how they too can help fight the virus to make a better future for our future generations. The COVID Latino project is transformative.
Cases are surging once again in the United States.
Now, they are making fake variants just to scare off public. Huh, look, nothing happens to me.
Uncle Rigo has the Delta variant.
Susana, how is it different from the other variants?
The Delta variant is more contagious than any version of the virus we've seen so far. It's 3 to 4 times more contagious than the last version of the virus, and it makes people of all age groups sicker faster. It's why we're seeing so many younger, healthy hospitalized now than we did this time last year. And in addition to the usual COVID-19 symptoms, sinus congestion, runny nose, and sore throat can indicate that you have the Delta variant. And it can cause major damage to your lungs. We have to be extra careful, Mama. Our best chance against this variant is for all of us to get the vaccine.
Yes, Susana. That is why I am glad I already got my vaccine.
We also collaborated with renowned cartoonist Lalo Alcaraz, who was up for 3 Pulitzer Awards. He was finalist 3 times. So we met with Lalo and asked, pitched the idea of a campaign that uses his art to bring needed information and messages to the Latinx community with a focus on the farm working community. And he was on board from the beginning. He is very passionate about the Latino community. He's mentioned in many interviews he's done that, this is a very personal issue for him and for all of us. We all know that one uncle, we all have that one uncle who's just hesitant, doesn't want to get vaccinated. We all know people in our Latino community who have these fears of getting vaccinated for many different reasons, whether it's a chip in the vaccine, whether it's going to cause infertility, these fears that are reasonable given the history of how migrant communities are treated in the United States, but that at the end of the day are really unfounded in any of the scientific evidence. So Lalo worked with us, collaborated with us to create content, and he did a series of cartoons, static cartoons, that we are using on social media campaign to disseminate and to get that information to the community.
Esto es extraño. Nunca me he quedado sin aliento. ¿Qué está pasando aquí? Nada tiene sabor. Dios mío, algo me pasa. ¿Cómo puedo olvidar a mi perrito?
Zoila, puedes tener síntomas de COVID prolongada.
Oh no, pensé que había vencido al COVID.
Incluso después de recuperarse del COVID, muchas personas tendrán efectos del virus, y esto puede durar meses e incluso más. COVID puede afectar al corazón o a los pulmones, e incluso puede repercutir en el cerebro y en la forma de pensar o sentir. Pero hay muchos médicos que están trabajando para ayudar a las personas con síntomas prolongados de COVID. Algunas personas pueden recuperarse completamente con los cuidados adecuados. Un gran paso que puedes dar para protegerte es ponerte la vacuna, aunque hayas tenido COVID. Así que, Zoila, asegúrate de hacerte un chequeo y de llevar una máscara en la nariz.
So the impact of this campaign is still being evaluated as of October of 2021, but preliminary evidence shows that we reached quite a significant number of people. We have over 2 million people that we've reached with our cartoons and our animations, and these are conservative numbers. We're still doing the analysis. So we've reached over 2 million people, and we hope to continue to expand our work and create more content and have a bigger reach. We know that this virus is not going anywhere. This pandemic is not ending anytime soon. We're only at 50+% vaccination rate in the US, which is lower for Latinos in general across the US, specifically in areas like Arizona and California Central Valley, where vaccine rates are 20 to 30%. So we need to continue creating content. We need to continue getting the message out there and making sure that those who are more hesitant, who are less likely to get vaccinated, have the information for how and why vaccines matter, why vaccines help, and not just for the individual, but for the population. And that is the goal of this campaign, to continue to give information to the community.